Giovanna, I'm so glad you made it home and you're settling in well.
Well, glad you're here. Lucky for me, my sister Veronica's here to help me. I think we're both a little nervous that we're gonna forget something or do something wrong.
Well, I'm going to show you some things today that should make you more confident about how to look after the wound and how to prevent this wound in the future.
Okay.
Okay?
Having diabetes can reduce sensation in the feet and increases the risk of developing foot wounds. This video will tell you how to treat them if they occur and give you guidance on how to reduce the risk of recurrence in the future.
So one of the things you want to do is make sure that every night you check your feet. You want to check that for any signs of infection or any swelling, edema, and to make sure you check in between the toes as well.
Okay.
And also, you want to make sure before she puts her shoes on, she's going to wear socks and shoes every day and make sure your shoes fit well. So you're going to check the shoe to make sure there's nothing left inside or any rough edges or anything like that.
Right.
Okay?
But sometimes, no matter how careful you are, foot wounds still happen. If you notice a new wound, make an appointment to see your healthcare professional. To make sure you are prepared, it is important to always have on hand ribbon gauze, wrap gauze and tape, or a silicone dressing to cover the wound. You will also want to get something called an offloading boot, which is a boot with a cutout from your healthcare professional. This takes the pressure off of the wound when you are walking.
First, there are a few things you need to do very routinely to make sure that you keep her foot healed.
Follow the same sequence each time you change the wound dressing. First, wash your hands thoroughly and put on a fresh pair of gloves. Remove the old dressing carefully, placing it in a plastic bag for disposal. Cleanse the wound and pat dry. Remove gloves and place in zip bag for disposal. Wash your hands again before applying a clean dressing. You may want to wear gloves if there is discharge from the wound. Wash hands once more when finished.
You might cover the bed or other surface with a towel for protection. Remove the old dressing carefully and place in a zipped plastic bag for proper disposal. In the baggie, it's safe to be placed in your household garbage.
And then you can look at the wound, see if there's any redness, swelling, or any excess discharge.
Signs of infection include redness, swelling, change in wound discharge, fever, chills, or increased pain. If any of these are present, contact your healthcare professional.
Hopefully it doesn't hurt. If it does start to get painful, that might be a sign of infection.
After a shower or washing the wound with saline spray, thoroughly dry the foot.
Obviously, if you have a shower, you don't need to use this saline spray, okay? And you could dress it right after the shower.
If the wound is deep, you will pack gauze lightly into the wound to loosely fill that space.
When you fill the wound, you're just going to lightly fill it, okay? So just the inside of it, because the principles of wound care have to do with keeping the inside moist and the outside dry.
Then secure with a dressing on top.
There we go. Okay.
Place a sock on the foot and make sure the offloading boot is in place for walking.
Okay. Great.
You don't have sandals or
Flip-flops, no. Keeping the toes covered this summer.
Got it.
And the foot protected.
And how often do I change it, or when do I change?
It's important to change it every 3 to 5 days.
Okay.
But if she's taking a shower every day, she can change it immediately after shower. If you're taking a bath, make sure you don't let it soak in the bathtub.
Do I keep my foot elevated?
It's important to keep it elevated part of the day, but the main thing is that when you are up walking, that you're protecting the bottom of your foot and the wound.
So always wear my boot.
So always wear the boot. Okay. Any other questions for me?
No, but I feel a lot better.
Yeah.
Don't hesitate to call if anything comes up.
Okay.
We'll do that. Thank you so much.
Be sure to consult with your healthcare professional if you have any questions or concerns.